Everyone. Welcome to the fourth in a series of ENIL ECCL interviews, where we try to find out what people are doing in different countries when it comes to supporting disabled people to live in the community, people living in institutions. I'm very pleased to have with us here today Radmila Stojanovic Babic from the organization called Susret, which means a meeting, an encounter in Croatian. They're an organization providing community-based services, community-based housing to people with mental health problems in Croatia. And Radmila is going to tell us all about what they're doing. So the way this works is Radmila is going to introduce their work, tell us a little bit about their work, and then if she leaves something out, I'll ask her a couple of questions. The video will be available on ENIL's YouTube channel afterwards, and we can always put you in touch with Radmila in case you have any other questions afterwards or would like to work together. Radmila, I will pass the screen sharing to you. And I will stop my video. So if you try to show your screen.
Okay. Here it is. Hello, everyone. So as introduced by Ines, I am a social pedagogue and running community-based housing in Zagreb as an NGO called Susret. We have organized in 2006 with the idea that people with mental health problems had no services in the community. They usually go to the hospitals, and afterwards, when they go out of the hospital, there is nothing there, so they end up alone or without support of their family or friends or whoever, and they end up in the hospital again. And after a few such rounds, hospital, at home, or homeless, they usually end up in the institutions. In Zagreb.
Sorry, Radmila, can I interrupt you? I don't think we can see your presentation.
Don't you see that?
I don't see.
Sorry, because I can see it. I thought I pressed share. Good that you, great. Now, I guess.
Yes, now it works. Thank you. I'm sorry to interrupt.
No, it's okay. Yes, is it okay now?
That's perfect. Yes, yes.
Okay, so just a few words about some facts regarding Croatia, how many inhabitants there is, and the capital where we live is Zagreb with 800,000 people, which means that a lot of people have some kind of mental health issues, and they are not supported in the community. Apart from, there are hospitals, psychiatric hospitals, and apart from that, there is no community-based services where they can get support. So the last statistics said that there are 3,504 persons with mental health problems who are institutionalized, and only less than 1,500 is deinstitutionalized in the process, which was planned from year 2010 to 2018. And we think it's a big thing, because community-based services must be expanded, and people must have the possibility to live in the community and to be in the process of recovery where they live, not to be institutionalized, and in Croatian case, far away from their home, because there are institutions in different parts of Croatia. So far in Zagreb, there are only 23 persons who live in community-based housing, which is really not even a drop in the sea. Before I start about community-based services, I just wanted to present our organization, which was established in 2006. And somehow enthusiasts started the NGO with the idea to support people in the community with mental health problems. So we started with support of open society, and we rented apartments on the open market, and which has good and bad sides, as everything in life. And we signed the first contract with the ministry in 2011, which was very important for us because that means that we get funded every year, and we can count on that funds and on that money, and we can make some plans for the future, how many people we can deinstitutionalize. The good thing that we are proud of is that we are recognized by the city of Zagreb and got some apartments, social apartments, which really help us being more sustainable, because the price of social apartment is 10 times cheaper than the regular apartment which we rent on the free market. Also, we have 7 employees, because without people we cannot support people in the community. So we have social worker, occupational therapist, psychologist, social educator, and also assistant for community integration. So when we have established our organization, we have some goals which we, during the time as we progress, we change and we adapt and adjust. But mostly what we wanted to achieve is that people with mental health problems live successfully in the local community, which means that they have they are living in a regular environment where other people live, that they have a job if possible, or working activities for some people who are not able to sign the contract with the employer, to support them in a quality way of spending their leisure time, to reconnect with the families, which the connection they lost while being so many years apart from their families, from their friends, and being excluded actually. And of course, we work a lot on social network to support people how to not be supported only by the paid staff, but also how to extend their relationships and bring more people into their lives. The second goal is to regain the legal capacity, because many people who came from institutions are not having legal capacity. They are, most cases, automatically taken away from them when they're diagnosed with schizophrenia mostly. And we also think that living without legal capacity is, how to say, not a life to live with dignity, because people, although having mental health problems, they can be supported into bringing decisions and being responsible for their own life. Of course, during the time, Goal 3 emerged, and somehow we see that the money which the client gets from the system, from the social welfare, should follow him, so that he, how to say, he's the one who can choose the services, and he's the one who have the accountability, responsibility for his or her recovery in that way. And of course, our final goal is that that person should come here, live in the program, if we can say that, of community-based housing, but actually none of us is living in a program. We are just living. So we support every person to go on and to live this community-based living, and if possible, to end up by himself living independently with some kind of support, as much as he or her needs. And of course, there are many, many challenges, as you can think. So one is that the money we contract with our ministry is not enough and does not cover the cost, which is the how to say, dangerous thing, because running an NGO, you are depending on the money that we get, and our sustainability could be endangered. Of course, we apply for we write a lot of projects, we're asking for donations, but people are not very willing to donate for people with mental health problems, although many people think that we are doing a great job and it is so good and noble that someone is taking care of it, but not willing actually to donate. So I think that some of our tasks is to promote mental health more and widely, and therefore recently we co-organized one how to say, event, Mental Fest, where we promoted mental health issues and mental health, that it is everybody's business, and we connected it with the culture, with the music, so it's not just this psychiatric part of the thing, which is focus for the people, what that means. Also, one of our challenges is that how the society see NGOs. In a way, NGOs are like those who spend money from the government, and nobody sees where that money goes. From one way, from the public view, and from the government view is that we are some private companies or private entrepreneurs, and it is always question of ours and theirs, and somehow this position is very bad, because people belong to the community, and whoever take cares of them should be supported, if we see it that way. Then at the same time, we are in a bad position towards the ministry and towards the service providers, because state service providers have totally different position in the system. Although we have a better position in a way that we can be flexible, that we learn a lot, that we learn very quick, and we are adjustable to the situation of our clients, and we really feel that we work for our clients and people we are supporting, and we can quickly adjust. Of course, regarding DI process in Croatia, I think that although politically it's still going on, but actually it stopped, and not many things are going on, and we hope that it is just some kind of how to say, gap between the next thing, which will really start again in a way that to be a really process, ongoing process, because there is so many people in institutions and they don't have time to wait for people which are sitting in some offices. there is still, even though the situation is now much, much better than we started in 2006, there is still a lot of resistance. And among the people who are supposed to be opinion leaders that are still pro-institution. And of course, if we are devoted to DI process, that means that somehow it should be thought about gatekeeping. So if we provide DI, that people go out, that means that no new people should be replaced in a way that new people are coming in institution. So after many challenges that we are facing, I would like to spend more time on successes that we are very proud of, like the continuity and endurance. We are so proud of that because it is very good to start something, but to endure and to live every day and year after year took a lot of effort and a lot of enthusiasm of all the people, and that is something to be really proud of. So far in our organization, there is 12 persons who live in community-based housing who came from institutions. 4 persons came from foster families, which we also see in a way that they are maybe deinstitutionalized, because our position is that adult people are not, how to say, not the persons that need foster families and that should be treated as children in foster care. And of course, 3 persons came from their family because they were no capacity to stay there any longer, and they were in danger to be institutionalized, and instead they came to Susret to live in the apartments and get supported. And our best success ever is we are very happy if someone can get their legal capacity back and left our organization, and even better if left social welfare system at all. So that means that we really provide that kind of support that person can continue to live independently and with minimum support or no support. And that means that what we do, that works. That's all from my presentation. And that is roughly what I wanted to say, but maybe you want to ask some questions.
Yes, thank you. Thank you very much, Radmila. And really great to hear about what you're doing. And it's really commendable that you've managed to keep it up for so many years with all these different challenges. I did want to ask a couple of follow-up questions. I think we can keep your presentation here. It doesn't matter. I can just ask you not to fuss with this sharing facility. First of all, I wanted to ask you, how do people get referred to you? Because you said some people have lived in institutions, some lived in foster families, and you do have a limited capacity to take people. But how do they, the people that you have in your program, how did they end up?
Yes, that is a good question. They come and ask from many different channels. Sometimes people come to the Center for Social Welfare and they know about our program. When we open new apartment, we send a letter to the Center for Social Welfare that we have available 3 or 4 places, and if they do have someone who could fit in such kind of service, then we make an interview And we also would like to match people together, because it is not easy to live together with other people who are not related to you. But matching is something which is important, that people have some maybe interests, or somehow be connected, maybe from the same part of the city, or to have some history together or whatever. So different channels is that how people come, or they ask, and then we say to them, we will put you in a way on a waiting list. You know, when we open something, we will think of you, and that's how our last lady came from one institution, from Otočac, because the last time we were having open places, she was very reluctant to leave the institution. And we said, okay, so we will contact you again if we will have a place. And then she was invited for a weekend. She visited the apartment, and then she finally decided that she's willing to try.
Okay, thank you. And how do you make sure? So, I mean, there are some. We see at TNL for sure. There are some housing programs around that are not so good. So people leave institutions, you know, and they, although they live in smaller apartments, they still get treated as if, you know, they were living in an institution. So I just wanted to ask you, how do you make sure that those institutional practices do not transfer, you know, back into the apartments? Because I understand so that people do share apartments, they don't live on their own. So how do you
Yes, I think it is a very big issue, because if we bring the institutional culture into the apartments, then nothing is really done on this qualitative way. We think that people who are living in the apartment, which is not the perfect system that we promote, but is what is possible now, is that they are independent persons. So nobody is treated as a part of the family, as the part of this, how to say, apartment community.
Yeah.
So everyone is a person for himself, herself, and they are included in the things like choosing the personnel they are willing to be supported by, choosing how they want and to get money, because we don't prepare the food for the people in the apartments, but they get money. Okay. And support if they need it to make some budgeting, to buy food, to prepare food, to think of how they would like to be, how would they like to eat, and what and how. And of course, they can choose many things. They can make choices, and by that thing, we see ourselves as a good service provider. That people have choice, and that people have the freedom to make mistakes, to learn, to have the different kind of opportunities.
Okay, and so, to what extent, in terms of
yes, I think that this choice and the possibility to make choices and the involvement into this whole process of with whom I shall live, how, who is going to provide me support, that brings the quality actually, and that differs this kind of service providing from the institutional one, where you all have to eat at one time. We have to eat the same thing. You have to get up at the same time. So everyone is person for himself, herself, and plan their lives as they like.
Yeah, thank you. And who do they, in terms of the support people receive? I know that there is some personal assistance in Croatia, but do they qualify for personal assistance, or is it completely different?
You know, you mean in this supported program and call for proposals? Uh, yes, they do apply because the ministry has changed some rules, and they do apply, but we choose not to
Mm-hmm.
because it is how to say, it would be more institutional like
Yeah,
than we would like to support them.
yeah, which is
So that means if you sign the contract for personal assistant, that means that assistant should come every day 4 hours, whether you need him or not.
okay.
And we don't think it makes sense, because why to be supported if you don't want, if you don't
Yeah.
need that. But maybe some other day you need 20 hours support, and then
Yeah.
it's not possible.
Yeah, it shouldn't be like that. I mean, it should be
Yes,
flexible so that people can use the assistance when and where they
flexible.
need it. Yeah. And
Yes.
in terms of, I also wanted to ask you in terms of this, I mean, you said people can, yeah, they can decide basically how they want to live inside the program. What happens if they don't, you know, there are conflicts or people just don't? I think it's quite hard to share to share an apartment if people don't get along. Is there, can you provide the opportunity to people to move to, you know?
Of course, we do have.
Yeah.
Of course, people are. Every person is difficult in his own way or her own way. So we are trying to negotiate to find a place where person could live, with whom she could live. And I think the most important thing is to find. um something which is important for the person, someone could find. There's always something you could find to make person motivated
Mhm.
to get along to another person, or how to live with another person if they don't get along well. We all have situation in our life which are not perfect. So we need to learn how to get along.
Yeah, so you help people solve sort of issues that they
Of
have.
course.
Yeah. I just have two small, well, maybe not so small questions, but something that came to mind. What would you say is the biggest barrier for more people leaving the program? You said two people managed to regain legal capacity. So what would you say? Is it the legal capacity that's the biggest issue, or is it other factors that prevent people from leaving?
Yes, I think that what would help is this big issue that is housing. You know, if person don't have a family that where he or she could be supported, then they need a place to live. And if you don't have place to live, how can you do it? So we are now negotiating with the city of Zagreb how to find a way that people without legal capacity can sign the contract with the city, and that we could provide support to live there successfully and independently. That would help a lot to have a place to live, and then to move on.
Yeah, and the
Like in
people.
Netherlands, they have programs, housing first, and
Yeah.
yes, and in Croatia, people without legal capacity and people also with intellectual disabilities couldn't apply for such way of living. People who are socially excluded or who are in a risk of poverty, they can apply for such lists. And now we are trying to put people without legal capacity in the same position, actually.
So basically, people under guardianship cannot sign up for any type of social
Yes,
housing. Mm.
yes. And usually their legal guardians does not feel confident to sign the contract for them because they are responsible.
Mm.
And, many
Yeah.
things many things should be solved, but I believe that it could be solved. It is not such a huge thing, but it will take time. But I think also it will be changed as well.
Yeah, thank you. And the final question: what would it take for the program to have a wider reach? Or, I mean, you mentioned, I think, several challenges which are interconnected. But what do you think the state and maybe NGOs should be doing to make sure that more people who are living in institutions or foster families are able to get out into society and to live independently?
Well, I think still community-based services are not, how to say, not spread enough not even in Zagreb, which is the capital, and even less in other parts. And without community-based services, there is no, how to say, some basement or basic things to well, not to initiate the process. The process is ongoing, but to somehow do it more massively. And also it will help prevent institutionalization in the first place.
Yeah. And
so we are working with the city of Zagreb, who is really willing to support and to provide different kinds of services in the community, so that would people even be prevented to go to the hospitals at all. So we just, this morning we had a meeting in the sector for the health part to organize something which would be community-based.
Yeah, thank you. And can I just add one final question? Actually, I just would like your opinion. We often get, you haven't mentioned how many people live together in the apartments, and we often get the question about the how many people should be living together, shouldn't be living together, and there are many instances where governments put 10 or more people to live together. This is kind of an average, a normal living arrangement. So I just wanted your opinion about that from your experience, given that you are a service.
Not many people can live together, especially because whenever we have an issue, if we are doing something right or wrong, then we ask ourselves, would I like to live with 20 people in an apartment or in a building? I would not. So I think it's the same for everyone, and also for people we are supporting. So we have apartments where only 2 people live. We have one apartment which is really huge, where 6 people live, and that is top. They are very good match, those 6 people, and they work wonderfully. But usually 4 people is the maximum in the apartment. I think that standard should be that every person has own room, and the issue is that we should think of people we are supporting same as we think of ourselves. I think that would be the main thing, because when people think for them it's okay like this or like that, it's really humiliating, to think that for someone else it's okay to live with 20 other people, and for me, well, I can't.
Yeah, thank you. I think this is a good way to end to end the interview, because that's I think you've kind of said what the main principle of your work is, and the kind of the key values. And so I thank you for your time, and I wish you, of course, lots of success overcoming all the challenges and continuing. And for everybody who's going to be listening to this interview, you can reach out to Enil if you would like to be put in touch with Radmila or her organization, and of course you can their website. We've shown that you can find out more. So thank you, Radmila, and
thank you for having me.